AdenoPlus comes complete with these components to perform a test, as well as one package insert per dispenser box. The package insert provides both written instructions and additional technical information about AdenoPlus. Extra copies of the package insert can be found at rpsdetectors.com. Each individual test kit contains a sterile sample collector, a test cassette, and a buffer vial.
By implementing AdenoPlus into your practice will help prevent the spread of infection, isolate and manage contagious patients, reduce unnecessary antibiotic prescriptions, reduce ocular allergies and toxicity associated with antibiotics, and help fight antibiotic resistance.
To prepare the test, open the test kit and remove the contents. Make sure there is no damage to the foil pouches. At this time, you may use an ocular anesthetic depending on the patient's discomfort level. However, please wait at least 5 minutes prior to collecting a sample. The ocular anesthetic will not interfere with the test results. To assemble the test, tear open the foil pouch labeled Roman numeral II, the test cassette, and remove the protective cap. It's important to note that the unused device has faint orange lines in the result window. Next, tear open the foil pouch labeled Roman numeral I, the sterile sample collector. Do not touch the sterile sampling fleece prior to collecting the patient's sample. Now, to take the sample, simply hold the sample collector in one hand. With your other hand, gently lower the patient's eyelid to expose the inside of the lower lid, the palpebral conjunctiva, then gently dab and drag the sampling fleece in multiple locations along the palpebral conjunctiva 6 to 8 times, and then allow it to rest against the conjunctiva for an additional 5 seconds. This will moisten the sampling fleece. Upon saturation with tear fluid, the fleece will glisten. Also, depending on the tear volume and composition, the fleece may appear white or patchy pink in color. However, if the fleece is not saturated and glistening, you should once again gently dab and drag the sampling fleece along the palpebral conjunctiva an additional 4 to 6 times. Next, you must properly assemble the test. Gently place the sampling fleece into the sample transfer window of the test cassette body. Press firmly where indicated until the test feels secure. A double click means the test is properly assembled. The test should be run within 24 hours of taking a sample and assembling the test. After this period of time, the results may change. To run the test, locate the buffer vial and remove the cap. Do not allow any portion of the test besides the absorbent tip to touch the buffer vial. Immerse the absorbent tip into the buffer vial for a minimum of 20 seconds. Then, remove the absorbent tip and replace the protective cap. Finally, place the test horizontally on a flat surface for 10 minutes. Do not interpret the test results before completing 10 minutes of development time. You will notice a purple fluid wave moving across the result window while the test is running. Once the background in the result window is white and 10 minutes have elapsed, the test may be accurately read. The results of the test are indicated through the presence or absence of 2 lines, which may appear in the result window, the control line, and the result line. The control line appears as a blue line in the control zone. This blue line indicates the correct application and performance of the test and must appear for the test to be valid. The presence of both a blue line in the control zone and a red line in the result zone indicate a positive result. An uneven or incomplete red line is due to an uneven distribution of eye fluid on the sampling fleece. Even if the red line is faint in color, incomplete over the width of the test strip, or uneven in color, it must be interpreted as positive. A positive result indicates the presence of adenovirus antigens in the tear fluid. This means the patient has conjunctivitis caused by the adenovirus and that antibiotics are ineffective at treating this viral form of conjunctivitis. The test is negative when only a blue line appears in the control zone. A negative result is indicative of an absence of adenovirus antigens present in the tear fluid. This means the infection in the eye is caused by something other than the adenovirus, possibly bacteria or allergies, and you should treat the patient accordingly. If a blue line does not appear, the test may be invalid. At this time, you will need to re-immerse the absorbent tip into the buffer vial for an additional 10 seconds. If a blue line still does not appear after 10 minutes, the test must be discarded and the subject retested by resampling the eye using a new AdenoPlus test kit.